Hi everyone, welcome back to my channel. Today I want to share my journey with arthritis from the first symptoms to finally getting diagnosed and eventually finding treatment that changed my life. I would like to give a short disclaimer that this video is for informational and educational purposes based on personal experience and should not be taken as medical advice. This video is something I wish I had seen when I was going through it all, because at the time I felt confused, exhausted, and honestly quite scared. It took me around 6 months to get a proper diagnosis, and during that time my body slowly felt like it was deteriorating. I also want to say that this is just my personal experience. Everyone's journey with arthritis is different. But if you're currently struggling with unexplained pain or going through diagnosis, I hope that this makes you feel less alone. At the beginning, I didn't fully understand what was happening to my body. I just knew I was constantly in pain, extremely tired, and everyday tasks were becoming harder and harder. Over time, things gradually got worse. I reached a point where I couldn't stand or walk for more than 5 minutes without feeling pain and discomfort. My ankles became extremely swollen because of water retention and inflammation. Simple tasks that most people don't even think about became difficult. At my worst, I couldn't zip up my jeans or even put on a bra properly because my joints and hands were so painful and stiff. That part was honestly emotionally draining because you realize how much you rely on your body for everyday things until suddenly those things become difficult. I was also completely exhausted all the time, lethargic, tired, drained mentally and physically. I actually became unable to work during this period because my body simply just couldn't cope. My GP eventually referred me for blood tests after listening to my symptoms. I also had bone scans, x-rays, and more blood work done over those 6 months. When the results finally came back, my doctor sat down with me and explained everything. Obviously, hearing the diagnosis was difficult and emotional because no one wants to hear they have a chronic illness. But strangely, I also felt relief. For months, I had felt like something was seriously wrong with me, and finally I had answers. Finally, I knew it wasn't all in my head. I knew what I was fighting against. That was also when I started learning more about inflammation markers, ESR factors, and how autoimmune arthritis actually affects the body. Diagnosing rheumatoid arthritis can sometimes be difficult, especially in the early stages. There's no single test that confirms RA. Doctors usually combine several pieces of information, including medical history. Doctors ask about symptoms like morning stiffness, joint swelling, fatigue, family history of autoimmune disease. Physical examination, a doctor checks for swollen joints, tenderness, warmth, reduced movement, blood tests. Certain blood tests can help support the diagnosis. These include the rheumatoid factor, or RF, anti-CCP antibodies, and C-reactive protein known as CRP. These tests help measure inflammation and immune activity. Imaging tests, x-rays, ultrasounds, or MRI scans may be used to detect joint inflammation, bone erosion, tissue damage. Early diagnosis is extremely important because these treatments can slow down the disease and help the progression to slow down, and also prevent long-term joint damage. My GP referred me to a rheumatologist so they could properly assess how severe my arthritis was and discuss treatment options. Luckily, my consultant was incredibly understanding and open-minded. I really appreciated that they listened to me and worked with me rather than just talking at me. One thing I quickly realized is that treating arthritis can feel like trial and error. Different medications work differently for different people, so it sometimes feels like ticking boxes and testing what your body responds to best. The first medication I started on was Methotrexate. For me, Methotrexate helped slightly, but not enough. I did notice some improvement, but I still felt really unwell overall. I was also taking prednisolone to help reduce inflammation. After that, I was prescribed sulfasalazine, and unfortunately, I experienced side effects with it. That was difficult because you desperately want something to work, but sometimes the medication itself can make you feel worse. Due to those complications I had with medications, I was placed on leflunomide. Luckily, my body responded well to this and seemed to work best for me, and I could feel an improvement. While there is currently no cure for rheumatoid arthritis, modern treatments can significantly improve quality of life. Treatment often includes anti-inflammatory medication, disease-modifying drugs called DMARDs, biologic therapies, physical therapy, exercise, and lifestyle changes. The goal is to reduce inflammation, relieve symptoms, and protect the joints from damage. Rheumatoid arthritis is more than just joint pain. It's a complex autoimmune disease that can affect many parts of the body. Recognizing the symptoms early and seeking medical attention can make a major difference in long-term health. One thing people don't always talk about enough is how mentally exhausting it can be trying medication after medication while still dealing with the pain every day. It genuinely felt like my life was on pause while doctors tried to figure out what would work best for me. Because these medications can affect your body in different ways, regular blood monitoring became part of my routine too. Even now, blood tests every month or a couple of months are important just to make sure everything stays stable. Eventually, I was started on TNF inhibitor therapy, specifically adalimumab. And honestly, it was like life-changing for me. I'm not saying it magically cured everything because there's no cure for arthritis. It's about management, not cure. But for the first time in a long time, I felt like I was getting part of my life back. I will definitely make another video talking specifically about adalimumab and how I overcame my fear of taking it, because it's an injection you take every 2 weeks, and that initially terrified me. But learning how much it could help completely changed my perspective. One thing I'm incredibly grateful for during all of this was the support from my loved ones. There were times I genuinely needed help getting around or doing simple things. And having people around me who understood made such a huge difference emotionally. Chronic illness can feel very isolating, especially when people can't physically see what you're going through. So that's my diagnosis journey and the beginning of my arthritis treatment story. If you're currently going through something similar, please know that you're not alone. Keep advocating for yourself, keep asking questions, and don't ignore what your body is trying to tell you. In future videos, I'll talk more about starting biologics and TNF inhibitors, overcoming fear of injections, the side effects and monitoring, how I manage flare-ups, mental health with chronic illness, lifestyle changes that help me as well, Thank you so much for listening and supporting my channel. If this video helped you in any way, feel free to like, comment, or share your own experience below. I'll generally love to hear your story too. See you next time.